Welcome back to another session with us at American Oncology Institute, Nange Specialty Hospital, Nagpur. Today we have with us Dr. Deepak Muthreja, Head of Department, Pulmonology, Critical Care and Sleep Medicine. After completing his MBBS from GMC Nagpur, he pursued MD in Respiratory Medicine from GMC Rajkot. He has also completed DNB in Pulmonary Medicine. He has cleared the European examination in both pediatric and adult respiratory medicine. He has been recently awarded the Fellowship of American College of Chest Physicians. So today's topic is lung cancer. So Dr. Deepak, what is lung cancer?
Right. First of all, thank you so much for kind introduction. Lung cancer. Cancer involving lung is lung cancer. What is actually cancer? Cancer is abnormal growth of cells. So the commonest causes increase in the life expectancy. For any cancer, the commonest cause has been because of increased life expectancy. There is abnormal growth of cells which are not being normally destroyed by the body, and it results in cancer.
Why is awareness about lung cancer is important?
So we reside in India. India is a TB endemic country. So TB is very prevalent in India, and henceforth we tend to lose these patients of lung cancer at the earlier stage. And because the symptoms of both the diseases are similar, any patient coming to us is already taken tuberculosis medicine in that span of time because the symptoms are same. So awareness about this lung cancer is very necessary.
Okay. And so what are the symptoms of lung cancer?
So lung cancer symptoms are cough, breathlessness. Sometimes the sputum contains blood. These are the warning signs that the patient should know. Whenever he is coming down with these symptoms, he should have one suspicion of lung malignancy as well.
Okay. And so what are the risk factors of lung cancer?
So earlier we used to think that only people who are smoking are going to have lung cancers. But no, there are certain genetic causes. There are also the environmental causes, like we have increased pollution nowadays. Everybody of us is talking about AQI, air quality index. And secondly, indoor air pollution. We hear our women who reside even in the urban areas that they're speaking about food which is cooked on chula or singli. These smoke also are predisposed to lung cancers. Anyhow, any kind of dust particle what you are inhaling can predispose to lung cancers, and there are occupations also, like people working in asbestos factories, industrial areas, they are predisposed to these malignancies.
So what are the challenges faced during the diagnosis of lung cancer?
So as I told you earlier that we are living in a TB endemic country, so whenever patient come down to us with the symptoms of cough, breathlessness, sputum production or fever, first they are being treated as a pneumonia or as tuberculosis. And when they come to a pulmonologist or a lung specialist, then only with the help of bronchoscopies and other tests, we are able to diagnose lung cancers.
So why is lung cancer diagnosed at a late stage?
So, because firstly, the patients are not aware about this lung malignancies. And lung is a very resistant organ. See, if anybody has a cancer of liver, stomach, or any other part of body, there is a substantial effect on the patient. The patients have a lot of symptoms, like if the patient has cancer in your food pipe, the patient will have vomiting and other symptoms. But for the lung malignancies, there are a lot many symptoms which are actually overlapping with non-malignant conditions. And a simple X-ray cannot diagnose a lung cancer. We need to do many tests for that. Like we have to do a CECT thorax. We need to do bronchoscopies. And for this, one has to pay from their own pocket. The second challenge is a financial challenge for what we face at the patient when it comes down to us. He has that another challenge of battery of tests what we are doing.
Can lung cancer be detected early?
Yeah. So it's now the world is going behind diagnosing lung cancer early. because a lot of money, a lot of finances of the government. Because in India, patient is paying from his own pocket, and the rest of the world, like in US and in Europe, the government is taking government is taking care of the health and also the insurance company. So everything is being covered there. So they are also being, because of a lot of financial losses, these companies, these government are also committed to diagnose lung cancer early. But in India presently, we don't have any kind of national program. We can diagnose lung cancer early by doing a low-dose CT scan. The patient who is heavily smoking, who is having high-risk factors like working in hazardous jobs or some occupations that are like people who are working in mines and industrial area, we need to, after 55 years of age, we should go for a CT scan of them. This will help us diagnosing lung cancer at the earliest stage. Now there are many tests like in presently not available in India, but there is like robotic bronchoscopies which are being conducted in Europe and US, which can detect even a small nodule of 8 mm or 1 centimeter. We can biopsy, then we can have a earlier diagnosis of lung cancer.
So what is the importance of early diagnosis?
So as with all the diseases, earlier the diagnosis, better is done. So if the lung cancer is spread throughout the body, the outcome is poor. If we diagnose at an early stage, we can provide a patient a curative end. Henceforth, I told you earlier that whole of world is going for early diagnosis of lung cancer.
Sir, what are the different modalities for diagnosis of lung cancer?
So we started with in X-ray. In X-ray also you are finding an classification. Then we can conduct other tests like CT scan, in which we can find if it is contrast enhanced, we can easily know whether that is malignancy or it is infection. Then PET scans can tell about the spread of the disease. The diagnosis with the help of bronchoscopy or CT-guided biopsy. Then we have EBUS, that endobronchial ultrasound, where the sonography probe is at the tip of bronchoscope, and you can see the places where the malignancy is there, and you can biopsy that. Then we have different other modalities like robotic bronchoscopy, which I talked about. Then peripheral bronchoscopy, cone beam CT. There are a lot many now modalities which are available. Yes, they are pricey. But if we are diagnosing lung cancer at the earliest stage, we are able to provide people benefit of a larger, higher life expectancy.
So what are the different therapies for treatment of lung cancer?
So treatment of lung cancer, according to the stages we divide, as I was saying that curative intent. So presently, surgeries are being done, lobectomies, pneumonectomies, segmentectomies. These are the surgery which are done for the lung cancer which are operable. Then for inoperable cases, we can do radiation therapy. We have different types of chemotherapy. Now we have these newer tests like immunohistochemistry, NGS, that is genome sequencing, in which we can know about the targeted therapy, and we can provide patient with a targeted therapy in which that molecule will alter that mutation which is present in the body, which is predisposed to cancer. So there are multiple modalities, and always I believe that there should be a multidisciplinary team approach. Like a pulmonologist should not be only treating that person. There should be a consensus between a pulmonologist, an oncologist, a radiation oncologist, and surgical oncologist. So all these four people can sit down together and decide a customized plan for that patient, and that will help patient to have a better outcome.
So can you shed some light on targeted therapy for lung cancer?
Yes. So what happens that most common cause of lung cancer is non-small cell lung cancer. So lung cancer divided into two types. One is small cell lung cancer and non-small cell lung cancer. Small cell lung cancers are very aggressive, and their classification, their modality of treatment is completely different than the non-small cell. And 80% of the population of lung cancer, what we see across the world, is non-small cell carcinoma. Now, non-small cell carcinoma are again divided into squamous and adenoid. These are main two types of classification of your lung cancer. If the patient is having some kind of mutation, Like there are multiple mutations like KRAS mutation or EGFR mutation. These mutations lead to lung cancers. Once we find this mutation and we provide a patient a drug which is actually going and acting on that mutation, the patient will have a better outcome. And secondly, he or she will not have the other side effects what we see in chemotherapy. And we are giving chemotherapy. Patients are very afraid of chemotherapy because of their side effects and adverse reactions. But this will not act on other parts of the body. It will go quite as far as target level because it will go to that tumor and will cause death of only those tumor cells rather than all the cells of the body.
Thank you, Dr. Deepak. Thank you for your time and this valuable information on lung cancer. Thank you, viewers, for watching this live session. Stay tuned for such informative sessions and subscribe to our channel. If you have any more queries, please comment in the comment box and even reach out to us through Messenger. Thank you.